Hi, my name is Venkat Rajan, Industry Manager for the medical device team here in North America. The delivery of healthcare in the U.S. is undergoing a fundamental change in the way it operates and functions. Rising costs of care have created a significant strain on care centers across the country. According to the American Hospital Association, a little over 30% of hospitals nationwide have a negative annual operating margin. Outmoded practices are requiring new and innovative best practices to help bring down the costs and streamline efficiency. Among the companies empowering that transformative shift is Wavemark Incorporated with their innovative inventory management platform. Surprisingly, many hospitals still depend on frontline caregivers to manually log in and out each product that are used daily. Those caregivers are burdened with administrative tasks that take up significant time and energy and also leave room for human error. Oversupply of products add up to unnecessary costs, while an undersupply could result in a critical situation if the clinician is unable to locate a certain product needed for a major procedure. Hospitals that have implemented the Wavemark system have reported annual cost savings between $50,000 and $100,000, in addition to an increase in the quality of patient care and a number of patients that can be treated. The product allows for better management of products purchased and assessment of future needs. By having access to updated data in real time, hospitals can accurately track an individual product and cross-check medical billing and ensure patients receive correct and non-expired products. Beyond on-the-ground efficiencies, hospitals have more robust tools for intelligence gathering and on their own business. Improvements and adaptations can be made in real time as opposed to at a quarterly or annual review usually when reports are traditionally run. Rather than simply leveraging existing inventory management systems that have been used in other industries, Wavemark's innovative platform has been designed from the ground up specifically tailored to the needs of the healthcare environment. Intelligence collected can serve both caregivers and technology developers, as Wavemark has the ability to bridge the information void that exists between device manufacturers and hospitals in terms of product development, deployment, and utilization. For these cumulative factors, Wavemark is the 2010 Medical Device Customer Value Enhancement Award recipient in Workflow Solutions.
Current methods of inventory management require frontline medical caregivers to manually keep track of items, leading to both a rushed job and less time available to care for patients. This company's RFID-based solution allows hospitals to automatically track each product received without burdening frontline caregivers, which allows hospitals to better manage the supply chain. Frost & Sullivan is proud to present the 2010 North American Medical Device Workflow Solutions Customer Value Enhancement of the Year Award to Wavemark Incorporated. Accepting the award is Patrick Littlefield, Chairman and Founder. Patrick?
Well, it's a pleasure to be here. Nobody is more surprised about this than my mother-in-law, who witnessed the starting of the company in my garage. Actually, maybe I'm more surprised. I want to thank my partner. I want to thank our investors, shareholders. Most of all, I want to thank our employees, and I want to thank Frost & Sullivan, because this is a really valuable lift to a small company. I think everybody knows just getting a little bit of mind share often makes the difference in making that next sale, and that's what it's all about. Let me say just a little bit about what we do. It's a little obscure, but I'm going to see if I can make it make sense. We've talked a lot about medical devices today, and people, when you think about medical devices, often you think about a piece of hardware or a piece of capital goods that the hospital purchases and installs and then uses. Well, there's another class of device. It's a consumable device. And I know we're all familiar with these things. They're things like implantable cardiac defibrillators, ICDs, pacemakers, heart valves. There's a long list. Eyes, knees, hips, spines, tissue. And this industry has come into existence largely in the last 30 years. And there is a torrent of money flowing through the hospitals that is largely kind of invisible, unmanaged, hard to see. And in fact, if you look at these labs, their operating expenses in the realm of these devices, so take a typical cath lab, it's anywhere from $10 million on the low end to $25 to $30 million. And that adds up to real money. So what we're really trying to do is to kind of make that torrent visible and make the information about it kind of move, and I'm going to use the water metaphor here, kind of upstream and downstream to the various people who need to have that information to match outcomes with costs and make a more efficient healthcare system. Because this industry that we serve is now about $80 billion in size, and it's your money and it's my money, and it's good stuff, and we need to make it to keep us healthy, but we also need to make it efficient and cost effective. So thank you very much. And I know I'm standing between you and your dinner, so I'm going to move on.
Austin Sullivan Best Practices Award in each category goes to a company that has shown outstanding leadership, strategic thinking, and execution in its industry and among all its competitors. Congratulations on attaining this crowning achievement.